I'm Dr. Brian Castelein at Brighton Foot and Ankle, and in this video we're going to overview what we call first MPJ arthrodesis. What this is this can be a bunion correction for the inside portion of the big toe. We use this procedure to fix bunions and arthritis, typically when both bunions and arthritis are happening at the same joint. What this is that we have this long bone called the metatarsal, and we have this smaller bone at the big toe called your phalanx. And when we fuse these two joints, we call it a first metatarsal phalangeal joint arthrodesis. I know, it's a mouthful. But what it means is we get rid of the bunion, we get rid of the arthritis, and most importantly for our patients, we're getting rid of the pain. Many times, and you're probably doing it right now, you're squirmish, you're like, what's happening? Why would we fuse a joint down here? Well, what's happening for these patients and for the people who need this procedure is they're having significant pain, significant swelling into the area. They also have significant damage to the joint. And many times they can only move their joint just a little bit, even when they're sitting in my exam chair or on their couch. But we don't care how their foot moves when they're in those spots. We care how their foot moves when they're walking. And we quickly can show them that if we put a little pressure here onto the joint, which simulates weight bearing, every single time this joint jams, it knocks, it hits, it is not allowed to come up to let them push off their foot. And so with functional motion being absent, functional again meaning how they move, how they're walking, getting rid of the joint is a blessing because it gets rid of their pain and it gets rid of their deformity to the area. The great thing about this procedure is it's pretty easy to recover from, and we can use it for a lot of different people. Other procedures that we do for bunions, such as the lapidus or lapiplasty procedure, check out our other video on that, or our MIS procedures, again, check out our videos on that. We're asking for the bone to heal into the mid portion of this metatarsal or into the base of the metatarsal. When we're fusing the end of the bone in this first MPJ arthrodesis, things heal really well. So we're able to do this in some of our patients with a little bit of an earlier birth date, with people who maybe have some osteoporosis or some other medical conditions that kind of slow down their healing process. This is our tried, this is our true procedure. When I take my board exams and when I write down my updates, whenever there's a question about what procedure to do, I always pick this one because we like to call it our gold standard. This guy is our Swiss Army knife. It gets rid of painful recurrent bunions, any damage to the joint, bunions that have, or bunion corrections, that have gone awry. This procedure kind of fixes everything. Well, what we're doing is, we're prepping the joint. We're putting a little plate onto the top of it, and we're stabilizing that plate and joint as it heals. And we're stabilizing that joint as it heals. When we finish the procedure, which is all done outpatient, we put you into a surgical boot and let you walk home right away. The entire time of the recovery process, you're able to walk on this foot, which is a great thing for it. Full recovery does take 6 to 8 weeks because that's how long bone takes to heal. And then after that 8-week marker, after that 6 to 8 week mark, we get you into normal shoes and we start really ramping up normal activity. Again, this is a great procedure that can fix big bunions, this can fix older bunions, this can fix damaged joints, or bunion surgery that hasn't worked for us. So come on down to Brighton Foot and Ankle and we can talk about fusing your big toe.